So in this video, I want to show you how you can quickly improve your sciatic nerve mobility. And this video is for anyone who's dealing with any obvious sciatica or sciatic nerve related issues, but also for anyone who might be dealing with some calf or hamstring related dysfunction in terms of general tightness or aches and pains that you may not necessarily have related to your sciatic nerve. And then further to this, if you're someone who's been dealing with any Achilles or plantar fascia type dysfunction, one of the things that I find clinically is that increased neural tension that could be contributing to the cause of why that Achilles or that plantar fascia has become sore and uncomfortable in the first place. So the first thing that we need to touch on before we get to any of those exercises is we need to clear up one common misconception around neural tightness or neural mobility. And that is that you can't stretch the nervous system, or at least not in the same way that we tend to stretch a lot of the muscles that become tight throughout the body. In most instances, neural dysfunction, mechanical neural dysfunction, is often a decrease in slack or an increase in tension along the course of that nerve or to the structures that that nerve supplies. So what that means is that if you have some neural tightness or some neural restrictions, trying to stretch that nerve with traditional muscular stretches won't generally have much, if any, effect on the length or the mobility of that nerve. So when trying to improve the mobility of the sciatic nerve, we actually need to take a step back and understand that that nerve originates from the lower back, passes through a number of structures that go down the back of the leg before that nerve branches off and supplies other parts of the lower leg below the knee. So if we have some neural tightness or some increased neural tension down the back of the leg, a lot of the traditional hamstring stretches won't necessarily be as effective, if they're effective at all, if we're just following the common principles that we follow when we're trying to stretch the muscular tissue that surrounds those nerves. So what we need to do instead, we want to make sure that you have some stretches or some mobility exercises that floss free that sciatic nerve, but also some exercises that target some of the common restricted points that can create that increased neural tension through that sciatic nerve. So as always with these videos, we want to make sure that we have a baseline or a starting point that you can refer back to after each exercise to gauge whether these exercises and stretches and any of these techniques have actually been beneficial for you. So again, if you're comfortable getting down on the ground, a really simple exercise here, a really simple pre-assessment, I guess, is to be up nice and tall and just trying to hinge forward from your hips and try and touch your toes as best as you feel you can. I'm relatively fortunate that I have enough mobility in my tissue that I can get relatively far down, but the point isn't necessarily how far you go, although that is an important thing to consider and remember. It's also how does this feel to get to the end range of that position, and where does it feel tight and restricted. If you're someone who does a standard hamstring stretch and you feel the tightness in the muscle belly or you feel the tightness at the back of the knee, they're actually two different structures that are the most restricted in that moment. If you feel like you have an increased tension at the back of your knee, that's not actually hamstring tightness, it's increased sciatic neural tension. If you're someone who feels that tightness at the back of the thigh and the middle of the thigh, would most likely consider that to be hamstring tightness. But if you're someone who bends down or does a traditional hamstring stretch and you feel that tightness at the back of the knee, the exercises and the things we're going to go through should help improve the mobility of that area in record time. So again, for me, when I do this, I can feel some tightness at the back of my leg. I feel a little bit through my thigh, so I'm fortunate there's a bit of hamstring tightness there, not just neural tension. But in terms of a max effort, I can pretty much get to almost to the bottom of my heel in this position. Hopefully you can see that. We'll come back to this again. So that when we do these neural flossing exercises and some of the other techniques that we're going to touch on, we want to feel like something's actually changed, just so you don't have to trust me, that you can see that these exercises might be a valuable option for you to continue with, so you can improve the mobility of that sciatic nerve long term. So the first exercise that I want to touch on here specifically targets the origin of that sciatic nerve. The idea being, if you have a nerve that's tight or a piece of steel cable or string that's pulled tight through the back of your leg, the origin of that tightness can potentially be the one thing that you need to address to basically free everything up further down the chain. So we're going to default back to an exercise we do a lot on the channel. It's just such a versatile exercise. Taking a ball or a foam roller, what we want to look for is we want to look for some tightness and some stiffness on the same side that that nerve is tight, or the side that we're trying to free up. So for me, it's this side. We want to place the ball right down the base of your spine, pretty much where your spine inserts into your pelvis and your hips. And there's a little bit of a wedge there. So if you come into the middle, then just off to the side. And again, what I'd like you to do is just lie down on top of the ball. Again, go looking for areas that feel a bit stiff, a little bit tight. They may potentially feel a fraction tender as well if they've been tight for a while. But essentially, what I'd like you to do is stay here for about 30 seconds or a minute, and then want to move the ball up a little bit and keep hunting further and further up the spine for any signs of some restrictions where the nerves could be exiting that form into that sciatic nerve. And then again, once you've had enough of this and once you feel like it's freed up a little bit, what we then want to get you to do is, as we said before, exact same test before, reaching forwards. And then for me now, I feel like I've got a fair bit more sort of mobility through the back of my leg without actually touching the back of my leg. So again, the nerve that runs down the back of that leg, if you can imagine that I pulled that tight at the lower back where it exits the spine, it basically can pull a bunch of neural tension and slack out of the area. And I think this is one of the most hidden pieces of a lot of soft tissue dysfunction that we see, is that if you do have some increased sciatic nerve neural tension, then potentially if you have some calf dysfunction, you consistently tear them, they feel tight all the time. You've got some hamstring dysfunction, you have hamstring tears. Even the Achilles can be pulled a little bit tighter or have more increased resting load. If there's a handbrake pulling from above that, it can challenge any of the tissue that is affected by that increased neural tension. And then the second thing that we can touch on here is the same kind of idea, is you can take that same ball and place it into the heart of your butt cheek where your back pocket would be, and we can basically get back into the same position, but this time into where the butt cheek is. You can roll onto the ball a little bit more. Now the reason why this is really important is because for everyone, the sciatic nerve can either pass through or closely behind that piriformis muscle, the muscle right in the heart of your butt cheek. We're just looking for an area that feels restricted. And again, it shouldn't be too hard for a lot of people to find a spot in that back pocket area. Make sure that you're very respectful, very gentle. Then on top of that, what you can do is once you've found a really tight spot, is if you can tense that tight spot up, so maybe you need to push your foot into the ground, maybe you can just tense up your butt cheek where the ball's pressing into, hold that for 5 to 10 seconds. Once you stop doing that and relax, the ball should sink in a little bit further. It should be a little less restricted and a little less tender than what it was 30 seconds ago. You can keep moving the ball around, looking for those restricted tissues, and then repeating that same process again of getting tight, holding it there for about 5 to 10 seconds, and then relaxing and experiencing that tissue giving and becoming less tender straight away. And then what we can do again, same as before, once you've done that, we can take the same approach and then see how far we can go compared to before. Again, hopefully you can see the difference here. I just feel like I'm going down a lot further now without necessarily having addressed any of the neural tension or the increased neural tension as it goes down the back of the thigh through the knee. And then the next two exercises that we want to touch on are very nerve specific exercises. They're called neural gliding exercises or nerve flossing exercises. And the first one is one we've done on the channel before, but it's a really, really simple one. Again, we can get you down onto your back again. We want one leg relatively outstretched. We want the one that you're trying to floss bent up to 90 degrees. I want you to reach behind your thigh and hold behind that thigh. The way that I like to do this is I like to have you start with your foot bent back. And all we're going to do here is we're going to basically extend your knee as far as you feel comfortable until you find you've reached a comfortable limit where you might be noticing some increased neural tension or even what may feel like muscular tightness. Either way, we want to come up as high as you feel comfortable, but we want to do about 10 or 15 of these so that we're trying to gently encourage the nerve to floss freely or floss free through all the tissue that it passes through in case we're missing anything sort of lower than the piriformis or the lower back where it originates from. And the interesting thing about this is if you keep your thigh in the same position each time and then just basically look to where your toes get to relative to the roof or the surface that you're looking at, what should ideally happen is by the end of this sort of 10 or 15 reps, you should feel like it's actually going a little bit further by the end of that, by the end of this exercise. And then again, what we should see once we've done that is if you get into hopefully a similar position again, try and do the same thing, we should then feel like there's a little bit more range of motion through there, a little bit less neural tension. Hopefully, if anything's tight, it may be more the hamstring, the belly of that hamstring, more than anything through the back of the leg, or maybe some tightness down into your calf. And then depending on how that specific exercise goes, there's another exercise that we can do that just hits things a little bit differently. And it's essentially the same idea, but what we want you to do with this one is we want to get you into a sort of like a classic sort of hamstring stretch position. Now for me, I like to have my knee bent a little bit and really try and sort of hinge back through my hip to pull a bunch of sort of slack out of that hamstring. And then all we want to basically get you to do here, the same sort of a concept, is we want to let you basically plant your foot on the ground and then gently sort of rock over the top of your heel. And you should actually find that when you come back into this position, you should feel like there's a little bit of extra tension going down through that hamstring. So instead of bending and flexing from the knee, we're really trying to bend and flex from the ankle as a way to try and shear free some of that sciatic neural tension. But it's also trying to really activate some of the muscles that are tight here to hopefully amplify that experience or amplify the results of this exercise. And then as you feel more and more comfortable, you can straighten that leg a little bit more to start with. And again, really trying to use the muscles in your ankle to bend and flex over the top of that heel. And depending on how much more tension you want from this exercise, you can lean forward more and more. So I'm feeling a lot of tightness through my hamstring here. If I bend it a little bit, I can then get a little bit further into the exercise. If I straighten it out, there's more neural tension there that I can feel. But essentially, I'm rocking back over the top of my heel. I'm not shifting my body. I'm actively trying to make this muscle, the muscles pulling my foot here, to be the thing that tilts me back and forth over that heel. And again, this one's a really, really nice one to do. So we get back into that same position again, and then coming down as far as you feel comfortable. For me, again, I hope visually this sort of plays out, but it just feels instantly looser for me doing this. And with that being said, if you are someone who has been dealing with some random dysfunction down the back of your leg, whether it is your plantar fascia, your Achilles, whether it is your calf, whether it's your hamstring, whether you've got some piriformis or some glute tightness, even some lower back pain potentially, try improving the mobility of that sciatic nerve to see if you can feed some much needed slack into those struggling areas to help them settle down a lot faster. So all the energy and the effort that you might be putting into stretching some tight muscles down through the back of your leg, it might actually be wasted energy if you aren't actually taking a bigger step back to potentially see the reasons for why those muscles have become tight in the first place. So as always, I genuinely hope that was helpful. If it was, please let me know in the comments down below. Please consider leaving a like and subscribe to the channel if you do want more of this type of content. If you want to help support me in the channel, please consider leaving a super thanks donation on the video. But again, thanks for watching, and I'll see you in the next one. Bye.